Have you had this one problem that you can't get rid of? You go from doctor to doctor, visiting every kind of clinic, every kind of medicine, just going off one medicine to the next, just bouncing, getting labs, getting all these things done, but there is absolutely no relief. Maybe there's some relief for a short period of time, but then these symptoms just come right back. And this could be anything, gut related, fatigue, brain fog, you name it. There's so many things that you could be going to the doctors for. But at the end of the day, you are not really getting any relief. Does that sound like you? Okay. Well, it's not all lost because there is something that is very specific and personalized to you and your health that is called functional medicine. Hi, my name is Dr. Lake, and I'm a functional medicine and a board certified internal medicine physician. And I have chosen functional medicine to be my primary practice. Although I do practice internal medicine as well, along with functional medicine, but I do functional medicine, it would be my primary practice. Okay, so what is functional medicine? Well, think about it this way. When you go to a tailor, if that's still a thing, so if you go to a tailor, you have something tailor-made for you, for your body shape, what looks good on you and all those things. Well, this is sort of like that. It's a tailor-made approach to healthcare. Your specific healthcare needs are addressed in this type of medicine. Yes, there are a lot of testings involved, but these tests are only done just so we can figure out what's the root cause. What is the main problem with today's medicine? Well, today's medicine is really a band-aid over, the real root cause of what's really going on. So what we try to do as functional medicine practitioners is that we take your DNA, we look at your genetics, we look at your biochemistry, we go deep dive into your health and your specific needs that your body has, physiologically speaking, and we pull out all those critical factors that are causing you to have such, fatigue, brain fog, abdominal issues, sleepiness, sleep disturbances. I mean, there's a long list of things, symptoms that you could have by just not giving your body the right type of treatments. So coming to a functional medicine practitioner means that you are going to be committed and 100% there with you as going through the process of this of the program. So you get your genetics, your full DNA profile done. We look at different genes that cause different known problems, at least that as far as the science has gone. So you're looking at the cutting edge of medicine is what we call functional medicine. Well, and then we do also prescribe medicine, but that is something that we don't like doing. But if we have to, we're able to do so. If you're already on any medications, we can still continue those on until you feel good enough that we can slowly taper those medications off, and you may be medication free for the rest of your life if you follow these protocols that we present to you and we bring to you in the programs. All right, so when you go to a regular healthcare practitioner, what do you find? There's long list of people just waiting in the waiting room. God knows when you're going to get your turn. But in this type of medicine, where we don't have the weight of insurance or weight of the quantity versus quality of medicine, we take our time. I would take my time talking to you for maybe an hour or 2 hours, depending upon how much we have to discuss for that appointment. And this is every appointment that we have with you. Now, imagine going to an urgent care or even an emergency room or even a hospital. This is not the case. A doctor will see you for 5 minutes, and that's probably more than what typically you get seen. You get seen for. I know because I was a physician, and I'm still a physician. I work in the hospital. I worked in outpatient clinics. I worked telemedicine. I've done all of them. Everything that there is any type of format I've completed. I've done it, but there was minimal patient contact, really, if I think about it, as opposed to what I'm doing now. The patient contact was not there. I missed it. I missed that one-on-one interaction with my patients. But this kind of led me away from the traditional medicine paradigm, going towards something that I can really spend time with my patients and get to know them very well. Unfortunately, in today's system, that's very hard to achieve. If you're spending more time, then you're not seeing more patients, and then you really can't get your you can't have your ends meet, and that's a problem for everyone. Therefore, most physicians they just try to do the best they can with the time that they have. So anyways, speaking of functional medicine, again, I would say that there are lots of tests lots of discussions regarding every aspect of your health, whether that be your physiological health, your emotional health, your environmental factors, what kind of social norms you have. So we go over all of these things, and there's a lot of counseling involved in this as well, along with actual treatment. So you really have to, initially, we start with something we call an elimination diet. We look for, what kind of food triggers you have. Are there any food sensitivities that you may have that are causing all the underlying issues, especially if they're gut related? But either way, we start with that. We order the labs. We go through all the process of getting all the labs back, and then we sit down and we make a whole plan for really for the rest of your life, if that's what you're going to follow, because now we know exactly which foods cause what and which are good for you, which are not good for you. And so your health improves significantly when you're going through this process. So I encourage you to go ahead and click the link below. Talk to me, get a consultation done. We'll go over everything that we need to go over according to this for our program. I specialize in gut health and also metabolic health. Metabolic health really means your diabetes, your thyroid. It all encompasses that. Weight loss as well, because that's part of your metabolism. And again, gut health, because I chose that because that's really where all the inflammation begins, right? So you have most of your immune system is not located anywhere else, but right in your gut. So an initial thing, when you eat something, that's where it gets introduced to your body. Any allergies you have really gets introduced in your abdomen, in your stomach. So, and that's where your immune system recognizes, oh no, this is a foreign entity. I need to fight against it. And what is that fight called? And when it comes to our system, it's called inflammation. Inflammation is the underlying cause of all of our problems for the most part. And be that you have constipation, diarrhea, you have even heart disease, all this diabetes, this is all inflammation caused by factors that are kind of foreign to the body, and it reacts to that. Therefore, so going forward, I would urge you to go ahead and book a call. We'll talk about what you need. We'll talk about exactly what your situation is, and we'll get you in a program, and we'll get you all healthy and back up to without having any fatigue. Start get rid of that brain fog, get rid of that constipation. We'll work with you, and hopefully we'll achieve some good results there. All right. Thank you so much again for listening, and I hope you learned something here, and hopefully we can work together in the coming weeks. Thank you. Bye.